there have been attacks on the VA for quite a while. There are efforts to privatize it and kind of chop it up, which are ongoing. So there's a lot of kind of bad press about the VA, but when you actually look at how the VA operates, it's less expensive. As I said, it's more equal, and they have better health outcomes. And the VA doctors that I know are pretty happy people because they're provided with factual information about things like pharmaceuticals and treatments. They are given the latitude to treat their patients without insurance company hanging over their head and telling them they can't do certain things. So they're able to just really focus on treating their patients, and their salary. So they just, they know they have a guaranteed income. They can just focus again on practicing medicine. So that's the VA system. And that's, I think, where we really need to be moving. And when Howie Hawkins was running for president, he and I drafted a health policy platform. And I recommend that you check that out, HowieHawkins.us. And if you go to issues, you'll see Medicare for All. And basically what we said was, let's immediately expand to Medicare to everybody. That's something that we could do tomorrow. Every single health professional in the country has a national provider identification number. And so every physician, even as a pediatrician, I had one of those numbers. And so we have a way to pay every single health professional in the country already, if we just expanded the Medicare system and improved the benefits of that. But then we really need to move, as I said, towards a national health system. And what Howie really advocated for, and I support as well, is a community-controlled national healthcare system. So, all health facilities are owned by the government, but they're set up and run by members of that community so that they have a say over what that hospital or facility provides, how the care is given. So, there may be issues of making sure that we provide culturally competent care in certain communities. So basically, each community is a little bit different. How do they have a mechanism to have input to say what their health facility, how it best serves their community? In terms of, so we basically called for an immediate expansion of Medicare to every person, to immediately get rid of the private insurance industry. They're just a money-making venture that is obstacles to getting the care that we need. And then start to create a national database so that we actually have accurate information about what's happening in our country. We don't, because a lot of private corporations keep that information as proprietary. In fact, a number of years ago, the Center for Medicaid and Medicare Services was going to require these private Medicare plans, they're called Medicare Advantage plans, the private ones, to release their data on how their healthcare dollars are being spent. And the researchers, were all like very excited about, we're finally going to get to see how this money is being spent. And of course, the insurance companies lobbied, the CMS put pressure on them, and they didn't force them to release that. So we still don't know how they're spending our public dollars. So creating a national database would allow us to have real-time information about outbreaks and health problems and maybe outliers and things. Okay, I'll plug it in just a minute, sweetheart. And then where was I? Oh, shoot. So then after creating a national database, also to create a national mechanism where we have feedback about what the healthcare needs are, so we can start prioritizing. We need to build hospitals, especially in low income and rural areas. We need to attract, health professionals to certain areas. We don't have enough primary care physicians. They are the backbone of a good healthcare system. So how do we make sure that we're training and getting the primary care physicians into the communities that need them? That would all happen immediately. And then over 10 years, we would phase to a completely publicly owned and publicly operated, transparent and accountable, democratically run national healthcare system. So that's where we need to go. And I think what I'll do is stop talking there and see, Chris, if you have any questions, or there's a couple other folks that are on the Zoom, or anybody on YouTube who might want to put a question into the comment area. I'm happy to respond to any questions. Thanks.